Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Tears. Introduction. Tears are more than just salty drops that fall from your eyes when you are sad. Actually, your tears clean your eyes every time you blink. Tears also keep your eyes moist, which is important for your vision. Tear glands produce tears. Tear ducts carry the tears to the surface of your eyes and then to the inside of your nose. Problems can affect this tear system, also called the lacrimal system. Problems can include too many tears, too few tears, or problems with the tear ducts. This program will help you understand tears. It explains the anatomy of the tear ducts, what tears do, and problems that can affect the lacrimal system. Tear glands and ducts. Tears help keep our eyes moist and clean. Without moisture, our eyes would dry out. When eyes dry out, they can be easily injured. Vision may become cloudy. Tears are made up of three components: oil, water, mucus. They also contain substances known as antibodies that protect against infection. Tears are made by a special system of glands and ducts located around the eyes called the lacrimal system. The lacrimal or tear-producing glands are located under the brow bone behind the upper eyelid, at the edge of the eye socket, in the eyelids. Tears move from the glands to the surface of the eyes through small ducts. Our eyelids also play a role in keeping our eyes moist by spreading tears across our eyes. Tears drain out of the eyes through very small holes called puncta. These small holes are also known as the lacrimal ducts. They are located on the upper and lower eyelids. From the puncta, tears enter small tubes called canuliculi. These tubes are found at the inner corner of the eyelids. From there, tears pass into the lacrimal sac. The lacrimal sac is next to the inner corner of the eyes, between the eyes and the nose. When you blink, the motion forces the lacrimal sacs to compress. This squeezes tears out of the lacrimal sacs, moving them away from the eyes and into the nasolacrimal duct. The nasolacrimal duct drains into the back of the nose. The nasolacrimal duct and the lacrimal ducts are also known as tear ducts. What tears do? Eyes water for lots of reasons. One of the most well-known reasons is that we cry when we are happy or sad. Crying is an emotional response. It helps release energy built up from an emotional experience. It also releases stress hormones from the body, helping a person feel better. Crying helps humans communicate with one another too. Think of a crying baby. The baby is crying to tell others that he or she needs something. The baby may be hungry or need a diaper change. Tears are also very important for eye health. They help keep our eyes clean. Tears wash out anything that irritates the eye. When something like dirt or an eyelash gets stuck in our eye, tears are made to wash it out. Some of the things that irritate your eyes can't be seen. If you walk into a smoky room, your eyes may start to water. This protects your eyes from the tiny particles that make up smoke. The same is true for cutting up an onion. Your eyes make tears to protect against onion fumes. Tears also help keep your eyes moist. Cold air and wind cause your eyes to dry. If your eyes get too dry, they can be damaged. When your eyes start to get dry, your tear glands respond by making tears to prevent damage. Sometimes tears are a response to an illness or other health problems. Allergies, colds, and infections can cause your eyes to become red, swollen, hot, and sometimes painful. When this happens, the eyes begin to water. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Watery eyes. Problems that affect tear production can happen at any age. Some problems are more common in children than adults. This is because children's bodies are still growing and changing. Some people have problems with watery eyes or too many tears being made. Watery eyes may be caused by congenital blockage in newborns, allergies, infection, a foreign body or a scratch in the eye, medicines. Congenital blockage is a problem for 20% of newborns. The tear ducts do not drain tears to the back of the nose because the tear drainage system is not yet fully developed. This problem usually goes away during the first 2 months of life. Allergens are substances that cause an allergic reaction. Dust and perfume are examples of allergens. When an allergen gets into the thin layer of the eye, it becomes irritated. This results in watery red or pink eyes and inflammation around the eyes. The first step in treating watery eyes caused by allergies is identifying the cause of the allergic reaction. Your healthcare provider should assess your eyes to determine the best treatment. There are many different infections that can cause watery eyes, including conjunctivitis or pink eye, as it is more commonly known. Your healthcare provider can help you choose the best treatment, which may include antibiotic ointment or other medications. A foreign body is anything that does not belong in the eye. When dirt or another particle gets stuck in the eye makes tears to wash it off. Sometimes the foreign body scratches the eye, which also causes the eye to water. To remove a foreign body, you can buy over-the-counter artificial tears. This helps lubricate the eye and makes it feel more comfortable. Most scratches to the eye will heal over time without treatment. Certain medicines can also cause watery eyes, including chemotherapy drugs, which are used to treat cancer, cholinergic agonists, which are used to increase saliva production, epinephrine, which is used to treat severe allergic reactions, eye drops, which are used to treat dry eyes. If medicine is causing your eyes to water too much, talk to your healthcare provider. Usually your eyes will stop watering after you finish using your medication. However, you should never stop a medication without the approval of your healthcare provider. Dry eyes. Some people have problems with dry eyes or too few tears being made. Dry eyes may be caused by poor tear quality, decreased tear production, eyelid problems, medicines, wind or dry air, blinking less often, vitamin A or omega-3 deficiency. Tears have 3 basic components: oil, water, and mucus. These substances are made by glands around the eye. If the mixture isn't right, the tears evaporate too quickly, causing dry eyes. Dry eyes can also happen when your body doesn't make enough tears. Reasons for this include being older than 50, as tear production decreases as you age. Being a woman who has gone through menopause, as hormonal changes may decrease tear production. Having certain medical conditions that affect tear production, such as diabetes, thyroid disorders, or vitamin A or omega-3 fatty acid deficiency. Having had laser eye surgery. Having tear gland damage, which may be caused by inflammation or radiation. Eyelid problems may also cause dry eyes. If an eyelid problem interferes with blinking, it can lead to dry eyes. With each blink, the eyelid spreads tears across the eye to keep it moisturized. Certain medicines may also cause dry eyes, including antihistamines used to treat allergies or decongestants which relieve a stuffy nose, certain antidepressants, hormone replacement therapy, some medicines for acne, some medicines for high blood pressure. Dry eyes may even be caused by exposure to wind or dry air, performing tasks that require concentration, such as driving, reading, or working at a computer. For people with mild symptoms, dry eyes may be treated with over-the-counter eye drops called artificial tears. These eye drops add moisture to the eyes. Prescription medicines may also be used to treat dry eyes. These medicines may include antibiotics, which can treat an infection of the eyelid, eye drops that reduce inflammation of the cornea, eye inserts, which are placed between the lower eyelid and eyeball daily and act like artificial tears. In some cases, treatment for dry eyes involves treating an underlying condition. For example, dry eyes caused by medicine may be treated by stopping or changing the medicine. A lack of vitamin A or omega-3 fatty acids can cause dry eyes. Adding these to the diet may help. Vitamin A is found in liver, eggs, carrots, broccoli, and spinach. Omega-3s are found in salmon, sardines, walnuts, ground flax seeds, chia seeds, and hemp seeds. Other treatments for dry eyes include closing tear ducts with tiny plugs or heat, unblocking oil glands, using a special contact lens that traps moisture. Surgery may be needed in some cases. For instance, dry eyes caused by an eyelid problem may be treated through surgery. When to call a healthcare provider. Contact your healthcare provider if you have watery eyes with decreased vision, pain around your eyes, the feeling that something is stuck in your eye. You should contact your healthcare provider if you have dry eyes and symptoms have not improved or have been present for a while. Symptoms may include red, irritated, or painful eyes.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. You may only think of tears as those salty drops that fall from your eyes when you cry. Actually, your tears clean your eyes every time you blink. Tears also keep your eyes moist, which is important for your vision. Tear glands produce tears, and tear ducts carry the tears from the glands to the surface of your eye. Problems with the tear system can include too many tears, too few tears, or problems with the tear ducts. Watery eyes may be caused by congenital blockage in newborns, allergies, infection, a foreign body or a scratch on the eye, medicines. Dry eyes may be caused by poor tear quality, decreased tear production, eyelid problems, medicines, wind or dry air, blinking less often, vitamin A or omega-3 deficiency. Treatment is available for problems with the tear system. Talk to your healthcare provider if you are experiencing symptoms of watery or dry eyes. Thank you for using Explain.